Good morning, and thank you for joining us on this wonderful Martin Luther King holiday. Um, it's an interesting word, thank you. It's an interesting phrase, thank you. It's something that's, for some reason, lately has been a sign of weakness. But for us today here at Black Doctor, we want to say thank you. We want to say thank you for supporting us for the past 16 years. We want to say thank you for joining us today on this momentous occasion, the state of Black health. What is health? Health is can be defined in many ways. There is financial health, there is mental health, there is physical health, there is spiritual health, but all of that is important to each of us that we maintain our health. And so that's what we're here for. So, in the spirit of Martin Luther King, who was about moving people forward, bringing people together, and the spirit of making sure Black people are in the best place that they can be, it is important for us. And that's why we chose this day to be focused on our physical health as well as our mental health. That's what we're here for, and that's why you're joining us today. So, before we get started, we've got a long day of activities and panels. So, we've got 5 panels today, all focused on some part of your health. So, before we begin, we have the rules. Number one, let us know where you're watching from. Put that in the comment section. We like to see where people are watching us from all over the world. Number two, what I'd like you to do is share, tag a friend, and share this. And if you have something that you want to know, drop a question in the comment section, and we will try to get to the answer. So I have said all I can say, and I've got to bring in our wonderful and gracious partner to this project, and that is Dr. Gigi. Welcome to the program, Dr. Gigi. Let me bring you up.
Thank you. Thank you. Good morning, Mr. Ellis. It is such a pleasure. And I'm just going to tell you one thing. One of our guests is waiting for a link, Dr. Hancock, who's going to be on our first panel. So if you could share that with her. I am delighted to be with everybody this morning. And, the late Reverend Dr. Martin Luther King Jr. spoke about health. And he said, and I'm paraphrasing here, of all the forms of injustice, injustice around health is the worst, the cruelest in my mind. And, as a physician, as the head of the Rodham Institute, the founding director, dedicated to improving health equity in Washington, D.C., I see it firsthand. I see it firsthand. I see it every day. And health, as Mr. Dean said, is about our overall well-being. It is how we feel, how we interact with our families and loved ones, how we do on the job, how we sleep, how we eat, the whole thing. And it struck me when I was pitching this to our partner, BDO, that we're so focused on COVID and we have not really talked about other health issues. And as I said, I've got a very busy practice. I've actually had 61 people who've been diagnosed with COVID over the last 3 weeks. And I'm happy to say that only one person ended up in the hospital, and that's somebody who had declined getting the vaccine. But I'm also seeing things like heart disease not being managed, cancers not being screened for. Right. Mental health, of course, has been, just so hard and difficult to deal with for everybody, but particularly our youth and our teens and children. And then, of course, heart disease, which is the number one killer of all Americans in the United States. So we thought how appropriate to choose today to honor the legacy of the Reverend Dr. Martin Luther King Jr. And sadly, his legacy and all his work that he and so many others of thousands and millions sacrificed for is being threatened. And so, when we're talking about health, voting rights is part of that because that impacts policy, it impacts resources. Obviously, we can go on forever, but we've got an incredible panel, and I'm so glad to see all those people that are giving shout outs from Barbados.
Absolutely.
My God, it's amazing. So over to you, Mr. Ellis.
Well, we're going to bring on our guests, and we have two wonderful, wonderful guests with us today. We have, I like to call her a friend, but she is Dr. Lisa Fitzpatrick of Grapevine Health. So I'm going to see if she would like to list me on her friend list.
Of course. Hi, Dr. Gigi.
Hey, good morning or good afternoon now, right?
Yes, on the East Coast.
Yeah.
And then we also have Dr. Yolanda Hancock, and she has blessed us with her presence today.
Terrific. Well, can I introduce these lovely, wonderful, smart, and beautiful women who I call my friends? First of all, we are all part of the Black Coalition Against COVID, and I'd really suggest that everybody visit the website, which has all kinds of great information. Dr. Fitzpatrick is the head of Grapevine Health, the founding director of Grapevine Health, which she's going to tell us about a little bit more shortly. And she also has experience in caring for the other pandemic, which is HIV. And we're going to see what lessons we can learn from that. But she sort of takes her work to the streets, as she calls it, so that she can tell us exactly what people in our communities are thinking about. And then Dr. Yolanda Hancock, another star. We could just have stars this afternoon. She is a pediatrician. She has an MPH. She also has her finger on the pulse because she works and serves the good people of Ward 7 and 8. Matter of fact, the other day when she was calling into our steering committee, she was doing testing at one of the schools. And so she also has a program called Ask Dr. Yola. And if I didn't get things exactly right, please feel free to correct me.
Close enough, Dr.
Okay, all right, yeah. But suffice it to say that we have an incredible panel this morning that will really hopefully allow us to answer some of the questions that are popping up, because we know that this is ever changing. So I'm going to start with you, Dr. Fitzpatrick. What are people talking about in Omicron, and what do you want people to know about this variant?
Well, I want to remind people about variants. Variants keep cropping up because you mentioned HIV, and now I have HIV on the brain. Variants are cropping up because we're still seeing COVID-19 transmission, or transmission of coronavirus, the virus that causes COVID-19. So if we can decrease transmission, we're less likely to see variants. So what I'm hearing on the street and what I'm seeing on my cell phone when people contact me, number one, I'm surprised at the number of people who have completely checked out and they're not even thinking about COVID-19 anymore. They're hearing through the grapevine that this is like a cold, so why should I be bothered? And then I'm also hearing hearing from people who've actually never even heard of it, and I'm telling them about it for the first time.
Wow.
So that just gives you some idea. There's a lot of pandemic fatigue. People are tired of talking about this, hearing about it. And our messages are always the same with respect to vaccines. You should get the vaccine, to protect your community. Like, they can spew the talking points back to me at this point. Oh yeah, I hear it. You're not going to be in the hospital. You're not going to die. And so I just think, we have to continue to beat the drum and encourage people and let them know that we're a part of a community and that the variants will continue to crop up unless we each do our part. The masking, paying attention to symptoms. This is a big one. I think we don't pay enough attention to. Why is transmission happening? It's happening because people are getting COVID-19 and they're either blowing it off or not recognizing they're sick. So we need people to be very vigilant. If you have, a weird scratch in your throat, or maybe you get the sniffles, maybe you have a headache, lay back a little bit. See if the symptoms get worse. Go get tested, because that's how we're going to stop these variants. So I'm really hoping that Omicron, knock on wood, is the last one, but you just never know with this one.
Right.
Oh, that's right. What is the title of our panel today, Mr. Dean?
The title of this panel is "Are You Sick of COVID Yet?" So
Well, okay.
it's very
Well, that's what
appropriate.
I'm hearing. People are sick of it.
Yeah, people are so
And,
saturated.
and to be
Karen's not
honest,
sick of it.
even though I'm a healthcare provider, I'm sick of it too. But we
course.
have to keep going, right?
Yep.
So
Right.
So, Dr. Yolanda, you obviously are a clinician and have got a master's of public health. Tell us, and you're a pediatrician. I don't think that there's actually enough discussion for our communities about children. So, can you kind of give us a little update about Omicron in general, but children in specific as well?
Sure, but I first have to say that my most important job is that of mommy. That makes this even more important for me. I have a 9-year-old who's getting ready to go back to in-person school tomorrow. And so I was out in the cold for 2 days testing over 200 children, staff, and teachers so that my daughter could go back to school safely. So there was a little selfish incentive, right? But it was also to set an example for other schools in terms of parent, public, and private partnership. I have to thank LabCorp for providing the supplies for us to be able to do the testing. It was really a perfect example of how community comes together to make sure that children can be brought into school safely. And what I can tell you is that over the 200 plus tests that were done, there were 7 positives. So one, that speaks to the fact that the principal at her school did such an amazing job, the principal and staff, but also the community. The fact that over 200 students, staff, and teachers could get tested and only 7 positives show up, it means that families aren't tired of COVID yet. We're still scared. We're seeing the number of children going to the hospital increase in terms of emergency room visits, hospitalizations. Luckily, we have not seen a significant increase in ICU visits in the way that we do with flu seasons as a general rule, but we're certainly seeing an increase in ICU visits with the Omicron variant compared to any other of the other variants. And it's important to really have a clear understanding of what Omicron is bringing to the table, right? We were all scared about the Delta variant because it was twice as likely to put you in the hospital. It was 3 to 4 times more contagious than what I call OG COVID. But then came Omicron, right? Omicron variant is almost as infectious as what we would consider measles to be. Measles is like the biggest, baddest in terms of infection in the pediatric population. Again, and then came Omicron, right? Omicron's infectivity, how much it can cause infections and infect people, is pretty comparable to measles, which is one of the most infectious bugs that we have in our community. Not only that, the Omicron variant likes to infect the air tubes, the upper part of the airway. So all the previous versions of COVID really affected the lungs. And as my grandmother would say, from the rooter to the tutor, so from the crown of your head to the soles of your feet.
Right.
The blessing with Omicron is that you don't see the rooter to tutor impact. So you're not necessarily seeing the same risk when it comes to loss of taste, loss of smell, blood clots, kidney issues, blood pressure issues, etc. That's in the grown-up space. But in the pediatric space, because little ones' air tubes, their bronchi and bronchial, are much smaller. So if the grown-ups is like this big, right, the kids is smaller. So any inflammation and infection in a child's airway, in the upper part of their airway, it's going to cause more severe symptoms. And that's exactly what we're seeing. So I just sent a little one to the emergency department from my office just last week because he had difficulty breathing, very croupy, and it sounded like old school croup. So for any of you guys who are watching, who are used to old school, that barky cough, and you're like, ooh, he got the croup. If you hear that with your babies now, go get them tested. Don't assume that this is old school croup. This is new school croup, right? This is Omicron croup, which is behaving a whole lot differently. It means tapping into your healthcare provider if you don't have one, making sure that you go to a place like AuntBertha.com, which connects families to low cost and no cost healthcare services and helps families in terms of getting healthcare insurance. But it means activating a healthcare system so that your child or your children can be seen. Those are the things that we're really worried about when it comes to the Omicron variant, specifically related to our pediatric population.
Thank you for bringing up Aunt Bertha. It's an incredible app and website, and it has all kinds of resources from food to transportation to mental health services. And it's available. You just put in your zip code from any place in the country. It's free. So it's an incredible resource. Mr. Ellis, I feel like I'm hogging all the questions, and I know
Oh,
that you also have questions. Please.
well, yeah, I've seen. So thank you, everybody, for your comments in the comment section. So I feel you. So that's why we named this particular panel, Are You Sick of COVID Yet? Because we all are tired of it. And so, Dr. Fitzpatrick, my question for you is, you're out there in the community and I know you said people are just like, they're to the point where they're not even thinking about it. They're just like, we're going to go do it. How are we changing the messaging? And so, Dr. Gigi, I want you to answer this one too, because somebody said they saw you on CNN yesterday promoting this event, and they said you gave a really great answer about the messaging that's happening out there and how the messaging has been so mixed and so confusing that people are just like, you know what? I'm not even listening anymore. I'm just going to go live my life. So we'll start with you, Dr. Fitzpatrick. How do we get the messaging right where people will start focusing and treating this pandemic with the care and the respect that it needs to? And then and then Dr. Gigi, you can kind of follow up with your statement about messaging.
Well, Alice, I actually wrote about this on my Forbes blog a couple weeks ago because I know people are frustrated by all the conflicting messaging.
Mm-hmm.
And I think you have to go back to the beginning of the pandemic. We did such a lousy job across the health sector communicating about how science works and what we do and what we don't know, what we can and what we can't know. And because of that, there's been so much uncertainty. And remember, the public, this is the first time, at least in my career, that I've seen the public this engaged in anything related to science and health together.
Mm-hmm.
And so that was a missed opportunity for us. That was an opportunity to set the stage and say, here's how research works. The medicines you're taking, they go through the same process we're using for vaccines. And this is why traditionally it takes so long to bring a drug or a vaccine to market. And this is why it's going to be different because we're in a global pandemic. And then carry on helping people understand, okay, I know you're seeing modeling and why are all the models all over the place and why did they differ? Helping people understand what goes into modeling, what it means, and how modeling isn't real. And so I think we're really behind the eight ball, but we just have to continue. You know, Dr. Yola and I are working together a lot on this messaging and trying to get it right. And for people, she's done a bunch of Ask the Doctor sessions for us. We're opening ourselves to let people ask their questions so that we can help them. But I also think because people have differences of opinion, because there's art and there's science, even to research. The way you interpret the information you get back after a research study. Dr. Yola, Dr. Gigi, and I could all look at the same research findings. And then when someone says, well, what does that mean to you? We might all have very different answers. And that's just the way it has always been. But it's so much magnified in this pandemic because we didn't do a good job from the beginning communicating about it. And still, people are doing their own research, which really muddies the waters for people. And finally, I'll just give an example of this. A gentleman, I said to him, well, where do you get trusted health information? And he said, well, I do my own research. Like you doctors, I don't want to see your graphs and charts, and I do my own research. I said, well, tell me about that. How do you do your own research? Mm-hmm. He says, well, first I Google it. And then if I don't understand it, I have to pull up the dictionary so I can look up the words I don't understand. And then I also sometimes go to Medline and I read the study. I said, well, do you understand any of that? He said, well, no, but if it sounds okay, and then I will just figure out which one is the best for me. And I think this is too hard for people. We have to help them. We have to, leave the breadcrumbs so that people can really understand, and feel free to ask questions.
Yes, and to build on that, I think given the historic and ongoing health system and how it's treated people from the African diaspora as well as other communities, it is understandable, completely understandable, that there is a lack of trust from certainly mainstream sources. And that was the impetus behind Dr. Reed Tuckson and Mr. Ambrose Lane Jr. to have co-founded Black Coalition Against COVID.org, because there is trusted and vetted messaging that is specifically targeted to the African American community. So I would really urge people to go there. And I would just say, if Google was such a great doctor, and by the way, I don't want to throw out, Google, because
Right.
people do get educated. But if Google was such a great doctor, there wouldn't be really any need to seek out healthcare. There's a lot of information out there. It can be very confusing. But speaking about messaging, the example that I gave yesterday on CNN was, I don't think that there was enough in the way of setting the stage for why the information may be contradictory. And this is the example that I used. So just like a hurricane, just like a tsunami, just like a snowstorm, we have an idea, but you know what? Nature is going to do its thing. It's not going to say, oh, such and such radio station or such and such meteorologist said that this was the path that the snowstorm is going to take. And so what I say is, treat it as such, think about it as updates. This is a changing, evolving story. Stay tuned for updates, right? And I think also the messaging, sometimes, I think the people who are doing the messaging sometimes forget to speak in plain English and just kind of bottom line it. I don't want to hear why, you decided this and who all was involved. Just tell me what to do. And I think that that's why clear messaging of vaccines work, okay? They prevent not just death and disability, but I think we forget to talk about long COVID syndrome and the disability that comes from that. And we can come back to our panelists, that it saves us from having to lose work days and school days. And Dr. Yolanda can speak about that and the devastating impact. And look what's happening in terms of the workforce. We, of course, have always known who really runs this country, but look what happens when frontline people who serve and really keep those wheels turning are not available. We talk about first line, heroes as being physicians and nurses. Well, the reality is the person that stocks the shelves at a grocery store, the person who drives that bus, the sanitation worker, all of these people are important, equally important. We're all spokes on a wheel. So I think it's important for us, to be clear, to point to trusted sources of information, and to be vigilant in vaccinations, in masks. And by the way, not cloth masks, okay? They're not very good, but rather the N95, which can be a challenge to get, right? Testing and hand washing. So
I know you probably want to get to Dr. Yola, but I just need to add on to something Dr. Gigi was saying about the misinformation. We're very sterile and elitist generally, and very academic in these policy circles when we talk about health information.
Mhm.
We mentioned plain speak and how critical that is. But the problem is we have this culture in academia and policy. We're talking to each other rather than to the public. And if you were to talk at a level to help people understand, then people might see you as less than. And so we have to move beyond that, because we're here to serve the public. And the misinformation that's out there is on the level that's relatable. And it strikes an emotional chord with people when they show images and animations and tell stories.
Mhm.
We need to do so much more of that in science, health, and policy so that we can compete, because right now we are really being outcompeted with sensational information that's not true.
Well, before I come back to you, Dr. Yolanda, the one person that didn't get vaccinated, and by the way, who is paying the disproportionate toll of deaths and disability, it's Black people, brown people. But he asked me a question just before he got sick. Do people die of COVID or with COVID? I said, let me give you the example that my best friend gave. If you get up in a plane with diabetes and the plane crashes, we don't say that that person died of diabetes, right? So talk to us some more about what you're hearing and what some of those myths are.
Sure, I think one of the most important things that we also have to keep in mind, and piggybacking off of what you guys said, was the length of time that we put messages out, right? So right when vaccines were rolled out for the 12 to 17-year-old population, we did barely a decent job of talking to parents about the need. We did a phenomenal job from March of 2020 through the summer of 2021 of making sure people understood that children were not impacted by COVID. That was a huge mistake. Children were disproportionately impacted by COVID when you compare children to children. Children are not little adults. Children are children. And so when you compare children with COVID to children with flu, you saw that more children were impacted by COVID in terms of total numbers. They were more impacted in terms of complications, right? Once a child has the flu, for the most part, that's it. But 8% of children who have COVID will go on to develop long COVID. There is no long influenza. There's no long flu. There's no long pertussis. This is the only infectious disease where we see complications months, sometimes even year and out, that children are still suffering from consequences. And the long COVID symptoms that we're seeing in the pediatric population are those consequences that are going to impact them emotionally and academically, right? So children are more disproportionately impacted by by depressive symptoms, anxiety symptoms, memory issues. All of the neurological complications of long COVID are what we're seeing in the pediatric population. These are going to be the issues that can impact a child for their lifetime. And so that's what parents have to understand. And we did a piss poor job of helping them to understand that. We have to have a clear understanding that our children, their teachers, and everyone involved in their academic experience need to be protected and vaccinated so that children don't have to go back to a virtual learning space. My daughter cried. Ooh, it gets me emotional. She cried when she found out that she couldn't go back to school because she enjoyed being in the classroom. And my daughter, who's at a private school and can benefit from all the goodness of a private school and the resources that her mommy provides in a virtual space, because I used to teach elementary school, a lot of children, particularly Black and brown children, don't have that access. I can't imagine my mother, when my mother's 15 years older than me, and I love her to pieces, and she's the most resilient human being on this planet. But I can't imagine my mother having to balance two jobs when I was a little girl, my daughter's age, while simultaneously trying to figure out how to make sure I'm on a computer. Being from a rural town in Louisiana, shout out Independence, Tangipahoa Parish, I would not have Wi-Fi connectivity. I would not have had the access that I needed to be successful. And for almost 30% of families across this country, that's their story, just from Wi-Fi connection alone, right? And so we have to think about, what does this vaccine do to provide more equity among Black and brown children when it comes to educational attainment, parental financial stability, and keeping our communities running? Those are the messages that have to be pushed out. We still hear, like I just got a link yesterday from someone talking about the miscarriage rate associated with the vaccine because of bad data and horrible math. These stories continue to be recycled, but our messages are so stagnant. They last for the run of the vaccine campaign, and then that's it. So then it's people like Dr. Gigi, Dr. Lisa, and myself that are continuously out there, but we cannot outcompete the 12 organizations, people who put a lot of money, time, and resources into very sexy messages. And as sexy as our messages can be, it's the three of us. And so we have to figure out, how do we continue to fuel the movement to allow community conversation? Because for communities of color, it's all about conversation and relatability. It's not statistics, it's not graphs, it's not any of that. It's this right here that we have to do on a regular basis to help the almost 70% of 5 to 11-year-olds who still have not been vaccinated. Almost 70% of 5 to 11-year-olds still haven't been vaccinated. And we are only at 53% of those 12 to 17 who have been vaccinated, fully vaccinated. And less than 30% of 5 to 11-year-olds who've been vaccinated, that doesn't include full vaccination. And so families struggle to fully understand, why do I need to get my 6-year-old vaccinated when you guys have told me for almost 2 years that children aren't disproportionately impacted, when actually they are. 55% of children who are in the hospital are Black and brown due to COVID. Over 50% of children who have died from COVID have been Black or brown. We're now at almost 1,100 children in the span of this pandemic who have lost their lives, and the majority of them have been Latino families, who've lost children and Black families. And we haven't even talked about the over 140,000 children, disproportionately children of color, who have become orphaned because of this pandemic. These are the kind of comments. It chokes me up to even think about that impact and the fact that it's Black and brown children who are out here suffering from loss, mental health issues related to the pandemic. They may not have even had COVID, but they've lost their nana, their grandfather, their mother, their father, both of them. Those are the kinds of conversations that we have to have with our families so that they have a clear understanding. I don't care what so-and-so said on social media about you being magnetized after you got this shot. What's really going to impact you is the fact that when you go to your family reunion next year, and like a third of your family has been wiped out by COVID, let's have that conversation, right? The panic I experienced when my entire maternal family, including my 91-year-old grandmother, had COVID. And I had to pray every single day that God would spare her life. Like, that's our reality. And if I'm this emotional, and this was last year, I can't imagine what our children are experiencing and we're not checking in with them. But if parents fully understood the impact that the emotional toll that this is having on our children, they think twice about listening to Ray Ray from around the way, who's a DJ, but also has an opinion on COVID and the vaccine.
Can I jump in here, Dr. Yola? Because you are speaking the truth. And I'm really sorry about your losses. You know, there's been so much loss during this pandemic. So Ellis, you remember I had a little short-lived show, Straight Talk with Dr. Lisa. Like, that's
Love
what
that
people
show.
know me for, right? Straight Talk. So I need to bring out something that's related to what Dr. Yola is saying. And there's a comment here about how COVID was created to kill off Black people. I've heard this before. When, HIV, same thing. Also, when people hear the statistics, when you hear statistics about chronic health conditions, diabetes, cancer, heart disease, name it, we're always at the top.
Yeah.
And so I can understand why this would create a skeptical public when it comes to science, a skeptical Black public in particular. But in addition to educating the community about how science works from people who look like them and have lived experiences, I grew up poor. I understand how we think. I understand our culture. And so I think we have to bring that into these conversations and admit that it's real talk when someone says, was this purposely done to create harm? Now, I don't think it was, but we have to talk about why people think that. And so in giving the space for people to express that, we have to also be very honest about what we're doing to ourselves in the Black community. And this is not blaming the victim. So I don't want anybody in this straight talk, I don't want anybody to say Dr. Lisa is blaming the victim.
Right.
But just look at the food we eat. We have choices. Now, there's a whole nother conversation there about food deserts and why we have liquor stores and fast food in our communities. But we also have, even in my neighborhood where there's like one grocery store, it has lots of fruits and vegetables. And I'm constantly asking people, why are you passing the fruits and vegetables to go buy the macaroni and cheese? Like, that's a real conversation. But there are things that, aside from COVID, we're here that are killing Black people. The leading cause of death for Black people is heart disease. It's preventable. Cancer, largely preventable. And so, no, I don't believe COVID was created to kill Black people. But we need to be talking about the things we can do to make ourselves healthier, including, we hear a lot about, let me boost my immune system. The best time to boost your immune system is before you get sick or encounter something like a coronavirus. And what does that involve? It involves making different choices about how you move your body. If you sit around too much, they say sitting is the new smoking. Move even in your house. If you feel, I've had people say, it's too dangerous in my neighborhood, I can't go outside. I have an answer for them too. Walk around inside your house, turn on some music, have a dance party with yourself. If you live, there are different ways to move your body. You don't have to eat fried chicken 4 times a week.
Right.
You can drink more water. I mean, there are things we can do. I know the show is not about that, but I think
No,
it's
but it is.
It is
But
very
it
much
is, Dr. Lisa,
related.
because what you're saying impacts our health. I'm going to give a short example. Do you know that when you fall in love, your immune system is boosted, and guess what? When you break up, it's depressed. So mental health, they just came out with an article that, of course, we've always known that the stress that we feel impacts our rates of cancer, of all these different chronic diseases. So there is a wisdom in the community of really a lot of old school traditional practices, right? That do help, and food and sleep and sort of mood and stress is key. But I just want to also say that within at least the communities here that I'm familiar with, there is also a movement of aquaponics and hydroponics and farming
What
and all
is
of
that,
these things.
Dr. Gigi? Ponics. What is that?
Oh, thank you. Maybe you can explain. You probably can explain it better.
Got to break it down. Thank you, Dr. Lisa. Yeah,
I'm serious. Can you tell us?
No, I'm asking you. I don't know.
Oh, okay.
I don't know. And I figure if I don't know, a lot of people probably don't know. So.
Oh, okay. I'm sorry. So, for example, when there is not a lot of space that is available, you have these containers of what looks like a tree, where you can use water and nutrients to create very dense, very rich sort of vegetables, such as things that you can add into your food, like basil or rosemary or other things like that. Hydroponics speaks.
And spinach.
Pardon?
You can grow lettuce, spinach, all of your greens you can actually grow through hydroponics or aquaponics. Hydroponics and aquaponics are pretty much the similar systems. What it is a beautiful, because I've considered buying one, it's a beautiful plastic tower. And there's a water filtration system that pumps through. You add into that water system the nutrients that a plant needs in order to grow. And so there's certain veggies and certain fruits that you can grow through this system, and it can sustain you throughout the year. And it's a wonderful system. The water is filtered, so you don't have to worry about how you're going to find clean water to use. I know a lot of folks have strong opinions and concerns about tap water within the DMV and across the country, especially when we see issues around areas like Flint. So there are those considerations, but it's an excellent way to grow your own, especially when you
put that
find
in your house.
Yes, absolutely. It goes in your house. It stays in your house.
How
you
big
keep it
is it?
It's about 5 to 6 feet tall.
Yeah,
seriously.
and then there are different sizes, actually, where if you've got bigger space in the community, they can be several feet tall. And then the other thing is, in terms of aquaponics, I think fish can also be grown as well. But I want to come back to something, because we touched on it, and that is the misinformation about fertility. And let's talk about the unborn babies, or the babies that are being carried and nurtured and grown in a mother's womb with COVID. Can you please speak to that?
You want me to take it?
Yeah.
Absolutely. So one of the biggest concerns related to this vaccine is both miscarriages and impact on fertility. What I always like to start with is acknowledging where there is concern. So what we do know is that the vaccine, specifically the mRNA vaccines, have been associated with a heavier period or a longer period after you've gotten your shots. What we know with any time that you have a vaccine, especially with as strong as COVID facilitates a response, whether it be the vaccine or the infection itself, any inflammation that comes with getting a shot, which is a normal part of getting a vaccine. That's why your arm gets sore. That's why you might get a little bit of fever. The body doing what it's supposed to do is going to trigger a little bit of inflammation. With that inflammation, for women who are still having periods, it can affect your cycle. Not that the vaccine is doing anything to your uterus, your ovaries, your fallopian tubes, none of that. Everything is as it should be, and I'll explain why in a little bit. but some women have reported a heavier or longer period immediately after their first or second shot. What women have also reported is a longer and irregular period after having gotten COVID, but the impact is much longer with the infection than with the shot. So that's the first thing. I always like to acknowledge what we know to be true. The two concerns in terms of miscarriage and fertility issues, all of the information or the disinformation and misinformation is not true. What we know, even from the first studies, in Pfizer's study, 26 women became pregnant during that study trial. All 26 of them were women who received the vaccine. Within that study trial, 6 women had miscarriages. Of those 6 women, 4 received the placebo and 2 received the vaccine. All right. And then when you look at data that the American College of Obstetrics and Gynecology, which is like the leading organization within the country related to reproductive health, reproductive endocrinologists, all of these organizations collectively have said that it is best for women of reproductive age to get vaccinated against COVID for 2 reasons. One, because the vaccine has not been shown to impact fertility or the ability to carry a fetus to term. 2, for women who become pregnant and then develop COVID-19, you are at severe risk for a lot of complications. 1, pregnancy-induced high blood pressure. 2, preterm labor. 3, complications at the end of pregnancy that will result in a mother dying or the baby dying. I have had over the past 2 weeks at least 4 colleagues who've had patients who the mother delivered and then died within 2 to 3 days of having a baby. It is completely and totally devastating, as anyone can imagine, that this is what's happening. When we look at data from the reproductive endocrinology space, studies have been done looking at women who had received the vaccines and women who have not, to determine were there any differences in the ability to go through IVF, conceive, and then carry a baby to term. And there has been no data to show that women who received the vaccine had any less success in terms of becoming pregnant. The same thing in terms of rates of miscarriage. There was a study out of the New England Journal of Medicine. They did bad math. They defined miscarriages in the way that we usually don't. We define a miscarriage in the earlier part of the pregnancy, not towards the end. What the New England Journal of Medicine did, and I was surprised that they did it, was they looked at all pregnancies from the time a woman knew she was pregnant until she came close to giving birth, included that as the denominator. As you guys know, with math, this is taking you back to your middle school, even your elementary school math, the more you make your denominator, that fraction looks real different, right? So if I got a pizza pie and we cut it in half, I'm gonna get half the pie. But if we cut it in fourths, I'm only going to get a fourth of the pie. I'm getting less pizza the larger the denominator, right? And so we have to pay attention to what the denominator is in order to know what our risk is when we calculate these crazy statistics like percentages. So what the New England Journal of Medicine did was they messed up the denominator to make it look like more women who received the vaccine actually had miscarriages. They corrected their math, retracted the study, and put the study back out in November. So the study first came out in June. They pushed the study back out with, oh, our bad. Here's the corrected math in November. Well, some scientists in New Zealand were like, oh, well, we're going to take this math and make it even worse.
Right.
So they made the denominator even smaller to make the percentage even bigger. So now you see this story continue to cycle around where there's an 80% risk of miscarriage associated with the mRNA vaccines, and it was all based on bad math. When you actually look at the numbers, even if you go to VAERS, which is the reporting system that doctors use, or you go to VSafe, the reporting system that our community members use, you do not see any increased risk of miscarriage or issues with fertility. Now, billions of people have received these vaccines. If that was the case, we would have seen the data by now, and we do not.
But can I just jump in on this? I think, and I got to call you out, Dr. Yola. You had some big words in there, reproductive endocrinology. So that's okay. But I love the use of data. But what I heard in there, response to one of these questions, which is why is the answer always so different? And just going to come back to that again, because I think it's really important for us to acknowledge and be honest about the limitations, like what research can and can't tell us.
Right.
And so the best we can do is enroll people in our studies. So like with the vaccine trial, like hundreds of thousands of people around the world were in these research studies. And then they compared them to people who didn't get the vaccines. And then when they looked at all the information, they came up with some conclusions. But again, I would say if Dr. Gigi saw all those conclusions, I saw all those conclusions, and Dr. Yola saw all those conclusions, we might not always agree on what it showed. And
Right.
so what we try to do is give you the big take-home messages, because when we get into the nitty-gritty and into the weeds, it starts confusing people.
Right.
And Dr. Yola also said something really important, which was when they looked at which pregnant mothers had a miscarriage, 4 of them had not gotten the vaccine compared to 2 who had. So on that very simple level, those are the kinds of things when you're reading these studies that are just out there on the internet, those are the kinds of things you have to look for.
Right.
And one of three.
Can I say one thing? Go ahead.
Yes, of course.
I just want to say one thing as the layperson on this panel, and this is phenomenal, and I'm sad that we only got like 10 minutes left to this because Dr. Yola, you've been great. Dr. Lisa, you got a new fan club in the comment section. But I want to say this about messaging. I had the privilege the other day of sitting on a Zoom call with Dr. Cameron Webb and all of these wonderful, powerful people with great titles and a whole bunch of letters after their name and whatnot, talking about the messaging to the Black community regarding COVID. And so everybody was pontificating about this and that and the other. And when it came to me, what I said is reduce the messaging, keep it simple. Black folks not trying to hear all that foolishness. Here's what I would say. If I was running the messaging, I would say, here's the message. Keep home safe. Very, very simple. It's like stop, drop, and roll. I could tell you all about fire safety. I could tell you about asbestos and this and that, fireproofing the home and all the carbon monoxide. What do they tell you? Stop, drop, and roll. And you remember that messaging from the time you're a little kid. So if you say keep home safe, that message says, I don't care what the CDC is saying. I don't care what the FDA is saying. I don't care what Ray, the DJ, is saying. What I'm saying to you is this. If I'm going to protect this place where I'm living and the people that live with me, if I can do that, we have a better shot as a community of remaining healthy and beating back and getting those startling numbers that Dr. Yola talked about earlier, getting those numbers down. Focus on keeping home safe. And that if you don't want to get vaccinated. If you don't. But if you're not going to get vaccinated, do what you need to do to keep home safe. Wear a mask, watch your hands, watch your distance. And the last thing I'm going to say, and I'm going to pass to you, Dr. Gigi, is this. We got to get out of the blame game. We have spent too many years, the previous administration spent a lot of time discrediting facts. And we have placed opinion on the same level as facts. We've got to get back to the space where facts have more weight than opinion. You can still have an opinion. I'm not taking have an opinion, but your opinion doesn't equal a fact. The facts are the facts. That's what they are. And then we can talk about, as Dr. Fitzpatrick said, we can have an opinion. Those research studies you're talking about, they have results. It's the opinion of the results that we're talking about. But the facts are the facts. And so let's get to that place where we can respect facts, have an opinion, and keep home safe. That's it.
Well, I mean, I think that speaks to why your presence at this, this Zoom call.
I snuck it. I think I got the link from somewhere else.
But I mean, but it speaks to that if we're going to deal with COVID or heart disease or breast cancer or family health or mental health, which are the topics of our summit, we have to have all the people that are impacted at the table. Because if the messaging doesn't make sense, well, then that's a lot of, time. And by the way, I'll take blame as a physician. We're not doing so great anyway with other diseases. If we were, there wouldn't be a disproportionate impact and death rates and disability in all the other, issues or health conditions that I just mentioned. So thank you for, keeping it real. It is about honest conversations. And, I think that there is this tendency to find a group and say that they're the heroes or the sheroes. The
Yep.
people that need to, when it comes to schools, it is the people that keep the schools safe and clean and feed the children, and all of those other people that may not be visible, that have just as much of a stake in their own health and the community's health and an impact on the kids as anybody else.
Yes.
It's like
yes.
the people who pick up your trash
Thank
and
you.
deliver your packages.
Thank you.
This is just a reminder to be respectful and to walk with humanity and like treat every person you see like they're a member of your family. I mean, I've seen so much disrespect during this pandemic, not just for healthcare workers, but not even acknowledging the people who have kept society going as if they don't even matter.
Right.
Well, let me tell you, I'll share.
When you look at the risk factors, especially for children as it relates to COVID, the top risk factor is what their parents, what their mommies and daddies do for a living.
Mhm.
And the fact that 75% of Black and brown people cannot telework. We kept this country running we continue to keep this country running, to be honest with you. We are at the foundation of this country, period. And then we keep it running. But for children, it's what their parents do. So when you are disrespectful and not grateful to any and every person who's showing up to continue to allow us to get our groceries, to allow us to not have trash all over the place, you have to think about this person is sacrificing for not just us, but they're sacrificing and putting themselves at risk and their families at risk. It's like our military. We have to treat them with the utmost respect. They shouldn't have to have letters behind their names in order for us to show them love and respect.
Can I share a story? I went grocery shopping the other day, and the lady, who was probably my age, African-American woman, lovely. So, you just kind of chit chat. And she said, "Did you find everything that you needed today?" I said, "No, but that's because of the, the distribution and all that kind of stuff." She said, "Thank you for saying that." I said, why do you say that? She goes, "You don't know how many people have yelled at me." I'm like, "What?" I said, "This is a supply chain issue. What do you have to do with it?" I said, "Look, please know at least one human being on this planet so appreciates what you do." She cried. And I should also say that this abuse is not just heaped on randomly. It tends to be, of course, people of color, but mostly women of color, and Black women specifically. So I think that we, the people who are not necessarily heaping abuse, but we can also show appreciation and kindness. First, by acknowledging the person, and thanking them.
And that's how we started this whole thing. And I would love to have this conversation continue, but we're getting close to the end of our time. And I want to give Dr. Yola and Dr. Fitzpatrick a chance to shout out their organizations. How can people get in contact with you? It's I'll be starting the Lisa Fitzpatrick fan club. It's already started here in the comment section. Dr. Yola, you have been so real. I'm so happy. This is the first time where I get the chance to meet you, and this is wonderful. So I know this won't be the last. So we'll start with you, Dr. Yola. How can people get in contact with you if they want to hear more from you?
Absolutely. So you can follow me on social media at Ask Dr. Yola, AskDrYola. My website is also AskDrYola.com. Wednesdays at 9 p.m. Eastern Standard Time, I do a Facebook Live to provide COVID-19 updates, to address any myths and distruths, and to answer any questions.
And Dr. Yola is also on the Grapevine Health Speaker Bureau. What is Grapevine Health, you ask? So most of you probably know Black people get their health information and their information in general from where? Word of mouth on the grapevine. So I thought, why not put good health information, trustworthy, relatable, scientifically credible health information also on the grapevine? So we create video content. We have Ask the Doctor sessions. We have testimonials from community, because I think the more we share our health conditions with each other, it gives people the strength and the courage to even get a physical or avoid some of the same mistakes. So that's the kind of work we're doing at Grapevine Health. And who knows, maybe I'll talk to Ellis about bringing back Straight Talk with Dr. Lisa.
Well, you can come back anytime. I got your time slot ready to go, Dr. Lisa. So I will say thank you to our guests, Dr. Yola, Dr. Fitzpatrick, Dr. Gigi, wonderful, your co-host. We've got more panels, and they're going to be just as powerful as this one. So if you enjoyed this panel, next up at the top of the hour, we're going to be talking about breakthroughs in breast cancer with Ricky Fairley. We've got a wonderful panel guest talking about breast cancer. Then we're going to be talking about heart disease. Dr. Fitzpatrick talked about it today, the interconnectedness of all of these issues that we're dealing with. We're going to be talking about heart disease and the number one killer of Black Americans, and it is avoidable. So we're talking about that on our third panel. Then we're going to be talking about health of the Black family. So obesity, childhood obesity, hypertension, diabetes, all of these things that Black families as a system, multi-general system, are experiencing. We're going to be trying to overcome that, the way we eat, the way we move, the way we exercise. That's our fourth panel. Then the final panel of the day is going to be our mental health panel. How do we mentally get through all of this stuff, including our PTSD, which stands for post-traumatic slave disorder, and we got to get through that as well. So we're going to talk about all of that in the final panel of the day. So stick with us. Thank you for joining us for our first panel here on the state of Black health. Dr. Yola, Dr. Fitzpatrick, man.
Amazing. Amazing.
Yeah, thanks.
Thank you both, and we will see you soon.
Thank you.
Bye.
Thank you.